Hi, my name is Dr. Scott Rauer. I'm a clinical psychologist, and I'm here to talk about mind-body skills for people that have chronic digestive disorders or chronic digestive problems even to begin with. So this is a really important topic. The reason why is because stress really matters when it comes to having chronic digestive issues. People with chronic GI problems tend to have overactive stress responses. And it's kind of understandable. It's actually a natural thing given what you're having to deal with. The loss of control over your body, not knowing if symptoms are going to happen while you're away from home, having to be really careful about what you eat or really giving up a whole lot of variety of what you eat. It's kind of a natural, normal thing to have a large stress response. At the same time, stress is one of the biggest predictors of the severity of your problems or disorder or disease. It really sets up a vicious cycle where stress causes symptoms and symptoms cause stress. And this vicious cycle can just really grow and expand on itself. And so we know from research that the more severe your GI symptoms, the more likely you could develop significant anxiety and or depression, and the more significant and severe your anxiety and or depression, the worse your GI symptoms or disorder could be over time. So this is a real issue. It's a kind of a stuck loop, and really highlights the need for developing effective skills and strategies for addressing stress. So this is a real key piece of the puzzle that's missing for a lot of people, how to address the stress better. The good news is there are a lot of evidence-based tools of mind-body skills that go beyond just diet or supplements, exercise, medication, surgery, when those aren't enough. It's really a mind-body problem that's needing mind-body skills in addition to meds and the standard types of treatments if that alone isn't working or enough. So one of the evidence-based tools that I'm here to talk with you about today is called biofeedback. The one I want to talk to you about specifically is called heart rate variability biofeedback, or HRV biofeedback. This is a pretty cool area. So HRV is a measurement that a lot of fitness trackers like this Fitbit or like a fancy Apple Watch has built into it, or one of those Whoop straps. They measure HRV. HRV is a really useful metric to understand if you have chronic GI issues. And it's different than your pulse. So your pulse would be just the average beats per minute from your heart. Heart rate variability is different than that. You can think about it as it's a snapshot into the general state of your nervous system. It shows how flexible or not so flexible your nervous system is at any time in responding to stress. So if you map out how well map out someone's heartbeat over time, this lower part here, let me see if I can point to it, is someone that has a low heart rate variability. You can see it's kind of stilted, it's erratic, whereas someone that has high HRV is what the top one looks like, where their blood pressure is increasing and then decreasing with each heartbeat. That is an indicator of the healthy stress response comes on naturally on the beat, and then when the second half of the heartbeat, it comes down. It really shows that there's a kind of a gas pedal of the nervous system and then a brake pedal, a gas pedal and a brake pedal. Someone that has holding a lot of stress and doesn't have a lot of mind-body skills, or just their nervous system has been overloaded with stress over time, is not going to have that brake pedal to bring down the stress. So the less flexible your nervous system is at handling stress, the more erratic the heartbeat, the lower the HRV. the more adaptable the nervous system is at handling stress, the smoother the heart rate and the greater the HRV. So that's heart rate variability in a nutshell. The second part of the term HRV biofeedback is biofeedback itself. So biofeedback is kind of a way of using technology to become aware of things that are normally subconscious, like your heartbeat and the state of your nervous system. Being able to kind of see that and get feedback so you can start to change that. You can think about biofeedback as putting control knobs on your stress response, and you can learn how to engage it and build up the strength of that brake pedal to kind of be letting go of stress over time. So I have been teaching mindfulness meditation for the last couple of years for people with GI disorders, because that is what I have found to be really helpful for me in navigating stress and letting me navigate living with Crohn's disease. And so that is something I've been sharing with people, and it tends to be a pretty effective tool. Something I have just stumbled into recently is HRV biofeedback. And so what I'm really wanting to do is to really understand how effective is this tool for people. So I found this book that has a really great 10-week structure to it, where you're practicing a significant amount over 10 weeks, and you get to learn a lot about your body and your stress response. And so I wanted to put it out there into the internet and see who wanted to join me, and we'll collect some data over time and see how much this helps people in their GI symptoms. So we got responses from people from 5 different countries: in the US, in Australia, the UK/England, Canada, and Germany. And then also within the US, we got people all over 16 different states, East Coast and West Coast. And then a little bit more about this group. It's 40 people, and the vast majority are women. I think part of it is women tend to be a little bit more proactive on this stuff. We shall see exactly. I mean, that's part of it, but that's the current makeup of this group. And then here's the age breakdown. The biggest group is people in their 30s, but from their 20s all the way through the oldest is 60s. And then this is a little bit of a breakdown of the conditions that these people have. This is not a pie graph because people often have more than one condition. So IBS, irritable bowel syndrome, was the highest, 40% of people. And then Crohn's disease, ulcerative colitis, and then GERD and SIBO were the 5 biggest things that people checked off. In addition, there's a whole list of other especially functional GI disorders that people had from this group: dyspepsia, pelvic floor dysfunction, functional abdominal pain, and that type of thing. So my intention here is, with this group over 10 weeks, to go through this protocol to learn HRV biofeedback together with them and collect some data over time, and to report in, to kind of post on this and see how helpful it is or not, so that you can check it out and explore this if you think it might be useful for you.